Great. Thank you very much, Oz, Elizabeth, for inviting me to do this. Not an easy talk to give, but I'll do my best. So talk about ethics, my disclosure. So a lot of these companies that I do various things with are interested in AI and are exploring AI, but none of them are interested in ethics. That's not quite fair. I'm not an expert in ethics. I'm not an expert in computer science. So this is really kind of coming from a practical perspective, if you will. But I've been a surgeon for a long, long time, and I think all of us, when we were being cultured as medical students and residents, were taught about professionalism, right behavior, interaction like that. And that was kind of based on the old medical ethics with 4 tenets of autonomy, beneficence, and non-malfeasance justice. I think you're probably all familiar with those, kind of the bedrock groundwork of ethical medical practice. Surgery, though, is a little bit different. And I kind of phrase it as ethics, especially in surgery, is about choice. So if you do something and you had no choice, you had to do it, and something bad happens, it's just, there's no criticism to be made. Bad things happen, and there you go. On the other hand, surgeons make a lot of choices. Which surgery, which patients, what shall I do now in the case, what shall I do that? And we make a lot of compromises in that. So really, surgery ethics is very complicated and imperfect. I don't think you can say that there's a totally ethical surgeon out there because we have to make these compromised solutions, and sometimes we're wrong, sometimes we correct it down the line, etc. So it's a complicated issue, and we can talk a lot. I'm going to mostly talk about intraoperative kind of things, but certainly something to keep in mind. So how about AI or machine learning and surgery? There's certainly some ethical concerns. Several of the speakers this morning talked about some of those, touched on them. And they kind of go along like this. Data privacy, explainability, data bias is a big issue these days. And I added a couple others just out of the usual ethics box, which is misuse and access. So how about the data? As you've heard all along, and as all of you know, it's all AI, machine learning is all about the data, and that's not an easy thing. Part of the problem is that data, everybody wants it, because the growth in AI is powered by collection of data and sorting of data and access to data. And that means money. And money, anytime you introduce medicine and money into the equation, there's going to be ethical problems. So we all know that industry is looking at data. We have a charge to protect our patients, but it's tempting for our institutions, for ourselves personally, to do something that may verge on non-ethical. So I think we have to really sort out, and this is not clear, none of this stuff is clear, whose data is it? Because now everybody wants it, and they're fighting over it. Does it belong to the hospital? We certainly used to think that it was theirs, and they kind of act like it's theirs. On the other hand, as we do an operation, we choose whether to record it or not to record it. We do things like show it at meetings and stuff like that, because I think we kind of feel that the data is ours, because we made the decisions that led up to that data. We use that data to improve ourselves, and so we have kind of a proprietary feeling towards that data. But legally, the data is probably the patient's. Maybe they don't know what to do with it or don't want it, but they can certainly ask for it, and more they can get it and have rights to use it. So it's complicated. There's lots of things that are a push and pull, if you will, a wrestling match between patient privacy, maintaining that data, guarding that data, having it for our use in medical patient, physician-patient relationships versus wanting to send it out into the world so that computer scientists around the world can use it and build great new future and everything like that. And of course, industry wants to commoditize it. And we all want new products, and it's not going to happen unless industry gets involved. So there's a stress, and you've heard about that. That's kind of the underwriting of the bottleneck of all this AI in medicine and in surgery is you can't access the data easily. We're afraid because it's the patient's legally. Our hospitals don't want it to have. We could be fined. I think in the United States you get $10,000 for every patient information breach. So, you know, it's a real problem. I think in the ethical standpoint, you can ask yourself, is it used to advance patient care or to make money? So if you find yourself thinking, dreaming of a startup that you're going to own and stuff like that, and I think I'll record this case, that's probably not a real ethical thing. On the other hand, if you want to do self-review, if you want to teach, that's probably the ethical use. So, you know, there's big players out there, obviously. The big players are all chasing this data, and they're getting it, which is not making some people happy. As you know, a lot of people just don't trust those big players, and this is especially true in Europe. And in fact, you don't really know what they're going to do. They're almost as powerful as countries are these days, and that has to be a little bit of a concern as well. So we have to kind of negotiate around. So it's not just whether we should give it to companies. Obviously, they're going to have it some way to make our new products, but it's which ones should we give? You know, does it, by definition, belong to these big guys because they own clouds that are medically secure or not? And we have to kind of adjudicate that as well. Next thing I want to talk a little bit, and you heard a little bit about this, but I think it's very important in the ethical realm, is the explainability. Explainability is kind of becoming its own specialty, if you will, within computer science, because it's very important. You know, traditionally, these neural networks and things like that are really considered to be a black box. You throw data in there, something comes out, you don't know why it did that or how it did that. And explainability as a subspecialty of computer science tries to explain that. I think that's important for surgeons to think about that. And just to give you an example, 10 years from now, medical students go through a set of exams and things like that. It's fed into an algorithm, and out it pops, you can't be a surgeon. Because I predict that 10 years from now, you're going to be bad, you're going to have high complication rates, you're going to do that. That person has a right to make their own life choices, and they're going to ask, why? What was it? You know, how do you know I'm going to do that? And since it went through a black box, you really can't explain it, but you're going to need to. Another example may be you have a bad thing happen in the operating room. Let's say you're using one of those great algorithms that Silvana was showing, and something bad happens. Common duct's cut, and you used the AI, and the AI told you to cut here, or did something like that. And you go out and sit down with the family. What's that family going to say? You say, I'm awfully sorry, common duct was cut. I'm going to say, doctor, why? What happened? And you can't really explain what happened, why the computer told you that it was okay to cut here. So you're going to always have to be careful, and you're always going to have to keep that explainability from a medical standpoint in mind and retain enough control of things. If you're a surgeon that abdicates your responsibility and just doesn't pay any attention, just tell me when I've done enough dissection here, and then I'll clip. You're not being ethical. So data bias is really all about contaminated data, garbage in, garbage out kind of things. There's input bias that we kind of hear about, and we read about this all the time. It certainly is a hot cultural topic for us. is that, Silvana mentioned that we have a high-tech hospital and we record all cases, whereas a small rural hospital records no cases, and so there's not going to be any gallbladders from a small rural hospital in the algorithm that's produced. And that has an inherent bias, and it's really not terribly ethical if you're going to, produce a product that's going to improve patient care. That's not good. And we all kind of know about the white male issue, is that all this data tends to orient towards that because of accessibility, monetary, et cetera, et cetera. And all I can say about that, you can't control that totally, is, another one, of course, is statistically, even if you have great representation across the board, just statistically, if it's a rare disease in your database, when you apply it to a rare disease person out there, it may not give you a right answer. So what can you do about that? I think you can make these as non-biased as you can. Other examples are certainly translation. Well-done and non-biased algorithms for one question may not be immediately transferable to another. Maybe the algorithm tells you not to clip the cystic duct, but you want it to use it to not injure the common bile duct while you're dissecting, and can you really trust it to do that? And of course, well-done and non-biased algorithms for one culture or locale may not perform well when translated. So, an algorithm developed in the United States, taken to Africa, it may not be any good. One suspects it's not going to be quite as good. So you have to keep that in mind and try to accompany it. From the ethical standpoint, assuming that all humans in all situations are more or less the same violates that primary pillar of ethics, of justice, that each patient as an individual deserves the best. And so that patient in Africa is really not getting that. If you push that product down their throat, that probably is verging on not ethical. What can you do? You have to strive to make the data input as representative as possible. As I said, you can't ever weed out all this stuff. You just have to keep it in mind as you're building these products and do your best. And that would be the ethical approach. AI misuse, I think this is pretty common sense. Use of algorithms derived from patient data to make money from that patient without their consent is violation. It's like operating on a patient without consent or doing experimental surgery on a patient without getting their consent. And it's going to be the same for data. Taking that patient's data for personal gain or for something like that without informing the patient is not ethical. And I already mentioned, if you say, I don't care anymore about how I dissect this or how I put the mesh or whatever, I just don't care because the computer's there and I don't have to worry about it. That's abrogating your responsibility for that patient to do the best that you can, to watch that AI algorithm like a hawk and make your own independent judgments. There is a good point in this, though. Not using AI in a surgery when it's been shown to improve patient outcomes over standard of care it could be unethical. So we know now from colonoscopy that ADR rates are much higher when you use AI to kind of augment your colonoscopies. So is it really ethical to not use AI? It's easily available, it's standard, it doesn't cost all that much, and maybe we need to start thinking about that as well. Final point I want to raise is about access. In general, in the medical ethics field, it's considered not to be real ethical to have a beneficial or life-saving medical advance that's only accessible to part of the world's population, usually because they're rich or have infrastructure that could support it. And I think you all know what the great example of that is surgical robots. Large parts of the world are never going to have access to that and shouldn't. Even if they did scrape together $2 million to buy a robot, They shouldn't. There's pressing medical needs that they should ethically be spending on that. So fortunately, surgical robots don't have that much of a clinical benefit. So you're not really asking them to sacrifice better outcomes by not having it. That certainly would be unethical. So AI, all these things we're talking about, is certainly high technical advance, but unlike most technology solutions, it's uniquely transportable and potentially inexpensive. You have to consider those transfer issues, as I said. But so AI may be an ethical approach, because it could be. If you do it, all you have to do is do different population data sets and update your algorithms and make sure that they apply. So that's really a score for AI in surgery, is that transferability. So in conclusion, surgical ethics is not an easy topic to start with. AI kind of complicates it even more. Many of the ethical issues can be solved by careful and well thought out regulation. And you never thought you'd hear me say anything like that. But once they sort out how we can transport data and share data and use data, once patients kind of know what their rights to their own data is, or rights to the algorithm, we'll have support. Right now, we have to kind of decide all these issues, and that's not easy for a surgeon to do. The surgeon is responsible for the patient, not the computer, so you can't abrogate that responsibility. And AI offers a chance for improved care, potentially available for all because it's a computer program and everybody has a portable phone or access to that just about in the world. So with that, thank you for allowing me to talk a little bit about this, and I appreciate it.